Hello to everyone. Thanks a lot for the opportunity to present some of our study results. The topic is nanoemulsions as delivery systems of nucleic acids against breast cancers. Are they ready to use after long-term storage? So, what are nanoemulsions exactly? A short introductions. They are dispersed systems composed of an oily phase and an aqueous phase, depending which is the interface. Additionally, surfactants, or in this case of emulsions, emulsifiers are needed to stabilize them. Anyway, they are not miscible. Which is extremely important for nanoemulsions is the size in the range of 1 to 1000 nanometers. They can be used as a drug delivery or gene delivery systems like non-viral vectors for genetic materials. What's the specialty of our nanoemulsions? On the left side, you can see a typical nanoemulsions composed of an oil and an aqueous phase. The specialty of our nanoemulsions is their charge. They are cationic nanoemulsions. This is important because we are loading negatively charged nucleic acids, in this case plasmid DNA, and they can be bound by an electrostatic interaction. How we prepare these nanoemulsions? We use a microfluidizer model called ML100. The disadvantage of this microfluidizer is the volume. We have to prepare at least 50 milliliters, which is, in case of genetic materials, sometimes disadvantages. We prepared our emulsions at room temperature of 25 degrees Celsius with 600 bars and a microfluidization duration of 1 to 10 minutes. According to the characterization, we have set some targets. These are a mean droplet size of less than 300 nanometers. Why 300? Because for cancer cells, there is an enhanced permeation and retention effect. And there are junctions of the cancer cells. And if the formulation is too large, yes.
Excuse me, I think we have a problem because we don't see your presentation in a presentation mode.
Yes, we have. We see just a title slide.
Yes.
Yes.
According to the characterizations, the size of less than 300 nanometers is very important for effective targeting. Another characteristics is the polydispersity index, which represents the average distribution of the particles, and it should be less than 0.3, which is an indicator for stable formulations. Much more important is the zeta potential. It is the surface charge of the particles, and for an effective electrostatic interaction with negatively charged nucleic acids, the formulations should have a zeta potential of more than 30 millivolts. In this case, it should be ideally between 40 and 50 millivolts. Our target was a complexation with plasmid DNA as a model DNA, and testing cytotoxicity is another target. Here you see an image of the prepared nanoemulsions exemplary from our study. We have prepared 5 different cationic positively charged nanoemulsions and a nanoemulsion here, EA, as a control. Like you can see in the compounds, we have used 2 different oil compounds as octyldodecanol and lauroglycol 90. We have used 2 different cationic agents, abbreviation as PS for phytosphingosine and DDAB for didodecyl dimethylammonium bromide. And one of our members, an MD, has a lot of experience in the cancer type of glioblastoma, and he had the idea of using erythric acid, abbreviation as EA, which has some effects on positive effects on glioblastoma, mainly known from a popular movie called Lorenzo's Oil. I've given a short explanation in the abstract book. Additionally, we used surfactant in the oil phase of lecithin. We used soya lecithin. And the aqueous phase was composed of a salt form of phytosphingosine, which has a better water solubility, a second surfactant called tween 80, and of course, water. So we have prepared these nanoemulsions by microfluidization and characterized them in terms of droplet size, polydispersity index, and setup potential. Exemplary, you can see for cationic nanoemulsion 1 that with increasing the microfluidization duration from 1 to 10 minutes, the droplet size is decreasing. The polydispersity index has shown no significant changes, and the setup potential, which is important, is decreasing too, which is not wanted. Exemplary, the main subject here was to identify an optimal microfluidization duration. For cationic nanoemulsion 1, this was 1 minute. For the cationic nanoemulsion 2, again, it was 1 minute. But for the emulsion 3, we have decided to use 2 minutes because of two reasons. One of them was the polydispersity index, which was approximately 0.3 for 1 minute, which is not ideal and could lead to some instability issues. Another reason was the too high setup potential of approximately 60, which is not desired. It should be around 40 to 50 millivolt. The same procedure was done for cationic nanoemulsion 4 and 5, and here again duration of 2 minutes was detected as an ideal duration. So the next step, we performed the complexation with negatively charged plasmid DNA. In the table you can see the relation of the formulation to plasmid DNA and the resulted droplet size, polydispersity index, and setup potential. Of course, these parameters are influenced by the relation. The higher the plasmid DNA ratio is, the more disadvantageous formulations can be observed. But in our case, for cationic nanoemulsion 1 and his complex with plasmid DNA, the droplet size, polydispersity index did not significantly change, and the setup potential only slightly decreased to approximately 30 millivolts. The next step, here are the SDS Page Results, which are showing that there is a real complexation between the cationic nanoemulsions and plasmid DNA for the 4 cationic nanoemulsions. Unfortunately, cationic nanoemulsion number 5 was not able to form a complex. So this was a disadvantageous formulation, and for our purpose, it's not appropriate. According to the cytotoxicity results with 2 breast cancer cell lines, it could be observed again that the cationic nanoemulsion 3 here was not appropriate because the decrease of the viability of the cells was not very optimal. The same results were observed with MCF7 breast cancer cell line. So what's the main reason of our purpose was we want to produce ready-to-use formulations. Why? Because for any measurement like complexation, release, or any gene silencing studies, if the formulation is not stable, we have to prepare and produce it every time freshly, which is a serious disadvantage. So we produce it once and check it after certain times, durations and temperatures, the characteristics about droplet size, polydispersity index, and setup potential. Like you can see for cationic nanoemulsion 1, for 12 months storage at 25 and 40 degrees Celsius, they are, according to the droplet size and polydispersity index, stable. According to the setup potential, there is a serious decrease of the setup potential if they are stored at 40 degrees, which is or can be expected and is acceptable, I think, in my eyes. Cationic nanoemulsion 2 and 3 have some other effects. Cationic nanoemulsion 2 is also stable after storage for 3 months. Further measurements are not done yet, and the studies are ongoing. For cationic nanoemulsion 3, A serious decrease in the droplet size was observed after storage of 3 months at 40 degrees here. The size decreased from 99 nanometers to more than 300 nanometers, which is out of range for our target, for our purpose of less than 300 nanometers. So this formulation is maybe not appropriate enough for targeting. The same tendency or a disadvantage was observed for cationic nanoemulsion 4, where a phase separation of the oil and aqueous phase was observed after 6 months storage at 40 degrees. The formulation stored at 25 degrees is stable, has no significant changes of droplet size and especially setup potential. And the measurements for cationic nanoemulsion 5, which looks like it is appropriate, are ongoing. Actually, we have finished the measurements of 3 months storage. And finally, of the short presentation, we have shown the transfection results of 4 different formulations. And from these 4 formulations, only one, cationic nanoemulsion 2, was appropriate with a high number of transfected cells. The rest of the formulations was not positive enough for further studies. So, to summarize, our 5 prepared nanoemulsions, from view of the droplet size and polydispersity index, they are all, and setup potential, they are all appropriate. But cationic nanoemulsion 5 could not form a complex with plasmid DNA, so it could be excluded. Cationic nanoemulsion 3 and 5 had not positive effects of cytotoxicity on the breast cancer cells, so they could be excluded too. The long-term stability results revealed that additionally, cationic nanoemulsion 4 was not appropriate and not suitable too. And finally, after the transfection studies, only the cationic nanoemulsion 2 left as an appropriate formulation for our purpose. So this could be used for further studies with small interfering RNA and gene silencing studies. Here are some research topics of our working group with lipid nanoformulations as gene and drug delivery systems, gene silencing and expressions, cell transfection and vaccine formulations. And if anyone needs any support, please feel free to contact us. And nice greetings from the beautiful Izmir in Turkey. It's warm, about 30 degrees Celsius at the moment. Thank you a lot for this opportunity.
Thank you very much for your presentation. We have a time for 1 or 2 quick questions, please.
Yes.
Okay, I have one. Any questions from the audience, please? I have one question.
Please.
You mentioned, yes, you mentioned the use of plasmid DNA for getting packed with the lipid nanoparticles, but yes, you also mentioned the gene silencing approach. That means siRNA, microRNA, so on and so forth. Do you have any idea how the complexes of your lipid nanoparticles with short nucleic acids are organized, and which are the properties of such complexes?
We have a lot of experiences. In the past, we used several small interfering RNA for different cancer types, and it depends on the formulation properties. We have to optimize the formulation so we can have in highly transfection. That's the key factor. And in this case, like you've seen, we have prepared 5 different formulations. In some cases, they are suitable, but according to the transfection, only one formulation left, it was suitable. So the formulation aspects of setup potential to form a complex to get into the cells. Here we used, I forgot to mention, we used HEC 293 cells, human embryonic kidney cells, as a model, and they were very advantageous. And for the future, we will test gene silencing.
Okay, thank you very much. Do we have another question, please? No questions. So thank you very much for your very nice presentation.